Live Fit Podcast, episode 142, Holistic Plastic Surgery with Dr. Anthony Youn.
But what it did really is it got me into really thinking, Glenn, like, am I doing the right thing? You know, is what all this stuff that I've been taught truly the right way? There has to be a better way to do this. And that's when I started putting my mind to creating this whole idea of holistic plastic surgery. And the idea of holistic plastic surgery is not surgery, is not, no treatments or whatever, but it really is looking at the body as a whole picture, okay? And so looking at things like nutrition and how nutrition can truly impact the health, quality, and the aging of the skin, looking at clean skincare products, looking at all the wide variety of non-invasive and minimally invasive options, and really using actual surgery only as a last resort. And that's what I consider holistic plastic surgery. These are chemical sunscreens that are used in tons and tons of sunscreens around the country. And what we've known, holistic health practitioners have known for many, many years, is that they can mimic hormones in the body. And they get absorbed through the skin, and they can actually be absorbed into the bloodstream. On top of that, not only does that happen, but they're also finding that they can really disrupt and destroy the coral reefs.
Welcome to the Live Fit Podcast with Glenn Johnson, your resource for all things that contribute to good health. You will hear expert advice and interviews with leading authorities on fitness, food, fat loss, mindset, and the mind-body connection. You will find show notes, articles, and health programs at livefitpodcast.com.
Yes, it is time once again for the Live Fit Podcast. I'm your host, Glenn Johnson, your guide to better health. Today's guest is Dr. Anthony Youn. He is a holistic plastic surgeon. This was a pretty bizarre concept for me at first. It took me a while to really accept whether I wanted him on the show or not, but he's going to explain to you in just a minute in really clear language what a holistic plastic surgeon actually does. I will give you a bit of a spoiler, but essentially he uses plastic surgery as a last resort, not a first resort. And it still took me a little while to kind of grasp why I should have a plastic surgeon on my show. What does plastic surgery have to do with the model for the Live Fit podcast, which is health improvement? And I started thinking that the way a person thinks about themselves really has a lot to do with how they treat themselves. If they like themselves and respect themselves, they will treat themselves much better. They will treat themselves with respect and feed their body and brain the foods that they need for that top running being and creature that we have, that we live in. So I thought, maybe if a person has a few problem areas or a problem area that's just really kind of keeping them down, or they've gone through a lot of work to lose a lot of weight and they have some excess skin, what are some things that they could do to kind of complete the picture or to get them moving in the right direction, to help them feel better about themselves, whether it's a reward at the end of some hard work or kind of at the beginning to help move them in the right direction. And this guy, Dr. Youn, has the answers for you. Once again, plastic surgery is not his first choice. He uses that more as a last choice. If everything else is inadequate and not quite enough for what is involved, then sure, plastic surgery is there. But I'm going to let him explain what he does, what his mindset is on this sort of thing, and I think you'll be impressed. Hi, Dr. Youn. How are you doing today?
Great. Thank you so much for having me on.
It's my pleasure. The reason I wanted to have you on is I understand that you're a holistic plastic surgeon, and that sort of makes my mind spin. I don't quite know what that means or what to make of it. I mean, it sounds good, right? Because, hey, I'm a holistic health coach, and holistic stuff is supposed to be pretty good for you. But what does it mean in your case with plastic surgery?
Yeah, so let me give you a little background here. So I'm a board-certified plastic surgeon. I did 4 years of medical school, 3 years of general surgery residency training, 2 years of plastic surgery residency, and then a year of a fellowship out in Beverly Hills. And so I've had I passed all the board exams, all that stuff. So I've had basically all the traditional training of a plastic surgeon. And I started my practice in Detroit, and I've been here for the last 15 years. And several years ago, I thought that I'd reached what I would consider the pinnacle of my practice. Everything was going really, really well. And what happened is that I had a woman who came to see me. She was in her late 50s, early 60s, and she basically told me, she said, Dr. Youn, I go out with my friends, and they've all had this and that done. They get Botox and this and that, and they've had some work done, and I feel invisible. When I'm with them, all the men that come talk to us don't really look at me, and I feel like things have really changed. And she said, look, I'm hoping that I could maybe have a facelift. So I took a look at her, and everything looked, reasonable to do a facelift. So I did that. And the surgery went very, very well. And then while I'm driving back from the hospital to my office, I get a page from the nurse taking care of her, 911, that she's bleeding and I need to go back to the hospital. So I turn my car back around, Glenn, and I floor the gas pedal, and I'm swerving through traffic. I get to the hospital, run up the stairs, run into her room, and I don't see my patient sitting there, but I see somebody who resembles Jabba the Hutt.
Whoa.
Now, anybody who does these operations knows that if you get bleeding with the facelift, it goes from 0 to 60 very, very quickly. And what happens is that the bleeding can intensify and literally fill up a person's neck to the point where the neck is so tight that a person can basically suffocate.
Whoa.
So obviously that's on my mind there, and I grab a pair of gloves, and not even sterilely, I take a pair of scissors and I cut her sutures out and stick my hand in, and I'm grabbing clumps of blood out of her neck, deflating her neck, basically saving her. I rush her to the operating room, I stop the bleeding, and the great thing is that 3-4 weeks after the operation, she looked great, and you would have never been able to tell that she had a potentially life-threatening complication.
Right.
But what it did really is it got me into really thinking, Glenn, like, am I doing the right thing? Is what all this stuff that I've been taught truly the right way? There has to be a better way to do this. And that's when I started putting my mind to creating this whole idea of holistic plastic surgery. And the idea of holistic plastic surgery is not surgery, is not, no treatments or whatever, but it really is looking at the body as a whole picture. Okay. And so looking at things like nutrition and how nutrition can truly impact the health, quality, and the aging of the skin, looking at clean skincare products, looking at all the wide variety of non-invasive and minimally invasive options, and really using actual surgery only as a last resort. And that's what I consider holistic plastic surgery.
What would you do instead of surgery? What are if plastic surgery is one of the last steps, what would you start off with for somebody who wants to look younger?
So first thing we always want to look at is their diet and their lifestyle. So if you are eating a poor standard American diet, as you well know, not only is that bad for your health, but actually it can really impact your skin. The quality of the microbiome, how your microbiome is, that really impacts skin and inflammatory skin disorders. So the first thing is definitely comes down to eating the right foods, encouraging people to shift their diet away from that standard American diet. The next, you want to look at clean skincare. There's so much out there with skincare products, and so much of it contains chemicals that are potentially harmful and can create hormone disturbances. So getting the person on the right clean skincare is important. And then once again, there are so many things that we can do with lasers and technology and injections that are either minimally or non-invasive to help reverse a lot of the aging and get people hopefully looking the way that they want to and the way they dreamed of. Now, I'm not unrealistic, and there are certain things that only surgery can take care of. So big thing is excess skin. So somebody, woman has had 4 kids and the skin of their tummy is real stretched out and it's sagging and hanging. Well, there's no cream or food that's going to make that go away. Only option is surgery. But really, once again, saving surgery for those instances where really that's the only option.
I get asked that quite a lot about excess skin. When I deal with people that lose weight, they have excess skin. Is there anything you can do? I mean, let's say you don't have as much excess as, let's say, would really require surgery, but you still have a little extra. Is there anything that you can do to tighten that up?
There are treatments out there that if you're looking at a pretty modest change, there are some out there. They're not very good. That's the problem, is that there are lasers, there are radio frequency devices where essentially they all work on heating the deeper layer of skin. Well, if you've got a small area, like let's say the face or the neck, then, excuse me, that these treatments can potentially create some mild improvements in that. But if you're dealing with the arms or the thighs or the tummy, those larger areas, they just really don't work very well.
And I'm curious what you were saying about some of the skincare products that people use can be bad for the skin and cause hormone disruptions and things like that. What sort of ingredients are doing this, and why are manufacturers putting it in there?
Yeah, so a lot of it depends on, they're putting them in there for many reasons. Some of it is because it can alter the texture and make products like, for example, sodium lauryl sulfate. That's something that's in certain types of soaps, and that helps soaps become lathery, and we like to kind of lather up in the shower, and that's something they put in to do that. One that's gotten a lot of press lately is oxybenzone and octinoxate. These are chemical sunscreens that are used in tons and tons of sunscreens around the country. And what we've known, holistic health practitioners have known for many, many years, is that they can mimic hormones in the body, and they get absorbed through the skin, and they can actually be absorbed into the bloodstream.
Ooh.
On top of that, not only does that happen, but they're also finding that they can really disrupt and destroy the coral reefs. So there are places around the world now that are banning those types of sunscreens from being used. I just got back from a vacation in Hawaii recently, and we went on a snorkel trip, and they said you are not allowed to use your sunscreens. Like, you can only use the ones that we have here because we don't want your sunscreen to cause damage to the coral reefs.
Is there an easy way of knowing if your sunscreen is reef safe?
Really look for oxybenzone and octinoxate. Those are the two main ones that we know will that can impact the coral reefs. The ones that we ideally go for are more mineral-based sunscreens like zinc oxide and titanium dioxide. Those have not been shown to cause any damage to the coral reefs, but it's oxybenzone and octinoxate, which also, I don't know if this is has anything to connection there, or if it's just circumstantial, but they also are the ones that are most known to be hormone disruptors.
Interesting. Are these chemicals used for some of the higher SPFs on sunscreens, or does it matter?
Not necessarily. The knock on the physical sunscreens like zinc oxide and titanium dioxide is that they can leave behind a bit of a whitish hue.
Right.
They don't really absorb into their skin. So what I so because of that, especially, you get people who they're at the beach and they want to look good, and here they get a mineral sunscreen and it causes them to look whitish, and they don't like it, so they use the oxybenzone and the octinoxate based ones because they're soft, they're smoother, they blend into your skin super easy, they're easier to use. But once again, you're trading the potential toxicity for it looking better. What I recommend for my patients who say, look, I don't want to put zinc oxide on my face because I don't want my face to look whitish,
right,
then there are sunscreens that have avobenzone. That's another product. That one is found to be safe. So I would say, for your face, use a facial sunscreen with avobenzone as a primary ingredient. And that way it's going to blend into your skin. You're not going to have the issues with makeup and the color. For the body, really try to go, if you can, with more of the mineral-based sun blocks, because it's just going to be safer, because that you're using larger amounts. You're covering large parts of your body. Try Go Mineral if you can.
Right. Okay. That makes sense. You are listening to the Live Fit Podcast. You can find more information about this episode, plus Live Fit's weight loss, health improvement programs, and coaching at livefitpodcast.com. See you there. And I'm dying to ask you about Botox. Is this something that really helps reduce wrinkles, or is it just a way to prevent more wrinkles from forming?
So it really does both. So Botox is the most popular cosmetic treatment probably in the history of the world. It's so popular. I mean, last year in the United States, over 5 million people had Botox injections, and it is the most popular treatment in my office. I mean, we treat probably anywhere from 10 to 20 people a day with Botox. But Botox is a toxin. It is one of the most powerful toxins in the world. And when you inject it in small amounts in people, you can kill them. So we don't do that. We inject it in the most minuscule amounts. And what it basically does is it weakens muscles temporarily. So if you inject a large amount in somebody, you know that person can literally develop major issues, because the muscles won't work. But if you inject it in the absolute tiniest amounts, minuscule amounts that you can't even hardly see with the bare eye, if you inject that into certain muscles of the face, then you can weaken those muscles. And those are the muscles that typically create wrinkles like the crow's feet, like the horizontal wrinkles of the forehead, or the frown lines between the eyebrows. If it's done in a very controlled fashion by a good doctor, then and it really works well to relax those muscles, to relax those parts of the face, and to reduce wrinkles there. Lasts about 3 to 4 months. It's a super easy treatment, easier than going to the dentist. The treatment can literally take 5 minutes. And we've been seeing really, people are happy with it. You get addicted to it because it gives you such a nice change in such an easy way.
So you approve of it, I take it, as part of a holistic method?
I do, and I tell you, I know a lot of holistic health experts, and so many of them get Botox. They may not admit it. They may not tell their followers that they do, but I see it on their videos. I've seen it on them live. I've had them talk to me about it. It's one of those things where, yes, if you can lead a happy life without Botox, and by all means, save your money, don't do it, and eat the right foods and use the right skincare products. But at the same time, be aware that, Botox is extremely popular, and there's so many people, like I said, holistic health experts that are out there that are talking about all these things, and they get Botox too. And it's okay. If that's you, it's totally fine.
There's no long-term health implications.
No, not that we know of, and it's been used for decades. And to my knowledge, we haven't had any. I've been doing it for the last 15 years. We treat, upwards of 1,000 people a year, and we've never had a true significant reaction to Botox. Yes, you can get a droopy eyebrow for a few months if it's, if it spreads, if it's not injected appropriately, but it wears off. Now, that doesn't mean that there aren't stories out there of people who've had issues that they attribute to Botox, and maybe there's some people who are profoundly sensitive to the effects of it. I can't speak on that because there are, you go online and you're going to find stuff like that, but it truly is something that I think is definitely not common.
You know what I haven't heard about in a really long time, many years, and it used to be, I would hear this word mentioned nearly every day, and now I can't recall the last time I've heard it. Liposuction. What is the story with that? Do you do it? Is it still something that people have done? What do you think about it?
So lipo is still the number 2 most common plastic surgery around the country. So it is still done a lot. Now, I don't do as much as I used to, although I still do a good amount of it. And I think the reason why it isn't talked about as much is because there has been the emergence of technology that has allowed us to actually get rid of fat without undergoing lipo. So there are treatments out there. We have one in my office called Sculpture. There's another one called Cool Sculpting, where you can permanently destroy fat, yet you leave the skin intact and fine, but you can use either heat or cold to permanently destroy fat and to reduce the thickness of fat. So the one that we use in my office is called Sculpture. It's a laser that can reduce the thickness of fat upwards of 20 to 24% after 2 treatments. Each treatment takes about a half hour. Now, the results aren't nearly as impressive as what you can get with lipo. I can liposuction somebody and take liters off of them, and you're going to see a massive change with that. And we still do that in those people who, find that diet and exercise hasn't quite done it, and they've got stubborn areas of fat that they just cannot get rid of. Then, yeah, lipo can tackle that. But more and more, we're finding people who have smaller areas, and they're looking for more modest changes, and they don't want to go under the knife. They don't want those risks. That's one of the things I think that's really great about plastic surgery nowadays, and is a big part of holistic plastic surgery, is using devices like this where there's very minimal risk, it's non-invasive, and you can really reduce fat and help to recontour people.
Give me an idea of how much, you say, small areas, how much could you remove with sculpture?
You can't really measure it in a cc way like we do with lipo, because it does take about 2 to 3 months to see the final result with it. But once again, what you look at, the studies show you reduce the thickness of fat upwards of 20 to 24%.
So you kill the cell?
Yep. So about 1/4 to 1/5 of the thickness of fat it can reduce. Now, that obviously depends on how thick the fat is. If you've got somebody who's quite large, that 20% reduction may not happen because they're so large, versus somebody who's at a very reasonable, healthy weight, and they just have this stubborn area of fat that they can't get rid of. That's where you're looking at really that 20 to 24%.
Interesting. And this process, the heat or the cold, kills the cell, and then the fat gets absorbed into the bloodstream and then used up?
Exactly. So there are studies that even look at whether the fat that's in the bloodstream, whether that causes the blood lipid levels and the cholesterol levels and all that to go up, and it does not. So everything that we've seen is because it's such a gradual clearance of the fat that it does appear to be very, very safe. And that's one of the big things that, really when we look at holistic plastic surgery, and my book is called The Evolution of a Modern Surgeon, that's the same idea. It's like, there's so many things that we can do short of surgery that the modern surgeon goes after that stuff first. So, for example, there are old school doctors out there who, you come in and say, you know what, doc, I've got this, I'm in great shape. I've got this stubborn area of fat on my thighs. What do you think we can do? And automatically they go straight to liposuction because it makes them more money, because they're more comfortable with it, or maybe they don't want to spend the money on a non-invasive option. So that's what I would consider more the old-fashioned plastic surgeon, where you jump to surgery not even considering the other options. What a modern surgeon does, what a holistic surgeon does basically, is even if you don't have that device and you say, look, there's not a lot of fat there, wow, you really would be a good candidate for cool sculpting or for sculpture. I don't have that device, but maybe let me send you somebody who does. That's really the way that we should treat people. So for me, I see somebody who has an issue, let's say for some loose skin under their neck, and I think, probably the best treatment for that is not a facelift, but maybe ultherapy. It's an ultrasound skin tightening treatment. I don't have that in my office, but I do send them to somebody down the street who does. Now, that means that I'm sending somebody to a competitor. That means I'm not making any money off of this patient.
Right.
But that doesn't matter because we're doing the right thing, because that's much, better. If I were to do something, I'd have to lipo them or do a facelift. Well, that's not the right thing for them. They've got better options.
Right. If that's not what they need, why talk them into that?
But unfortunately, that's not the way that it's always been in our society, in our medical, field. It's really, let me see what I can do, and because it's, it's a money-making thing, and plastic surgery right now is a wild west of medicine.
Wow, that does not sound reassuring.
No, because there are doctors out there who are doing operations that they aren't trained in. They are recommending surgery first when there are non-surgical options or injections that can get the patient the exact same type of a result. And so that really is one of the things that I'm passionate about, and why I consider this holistic plastic surgery, is because, once again, really treating people the way they should be versus what traditionally has happened quite often in our field, where it's a surgery first. There's a saying in surgery, to cut is to cure. Oh. And it means exactly what it says. It's, when I went through my training, and this was part of my book, Playing God, is like, you're trained by these old school doctors who, that's really the thing, is the epitome, everything, the apex of it is cutting. And that's what you want to do, is you want to cut on people. Mm-hmm. Well, that's the last thing that I want to do. That's the opposite of what a modern surgeon does, is, we save that for only when it's absolutely needed.
Right. Now, I'd like to talk about your book, Playing God. That's quite a lofty title, and it makes a lot of sense because that's what doctors are accused of all the time, of playing God. So tell us a little bit about that.
Yeah, so the idea about playing God is not that I feel like I'm playing God, but that old-fashioned surgeons, you know that whole surgeon mentality of they basically act as if they think they're God.
Right.
There was an old movie back where Alec Baldwin played a surgeon, and at one point he yelled, "I am God," and it's like, oh my gosh. That's how the old school surgeons quite often act, as if they lord over the patient and even the support staff and all of that. Well, that's not, for me, it's the opposite, and even though I've been trained by some doctors who felt that they were playing God, the idea behind it is that it's the opposite for me. Not only am I not playing God, but I need God to help me. So, for example, there's a story in the book where I had a patient of mine who came to see me, and she was in her, I think she was in her late 50s, early 60s. She had a tummy tuck done by another doctor, and everything completely fell apart. And she came in to see me, and at the time, I really had hit rock bottom in my practice. I was an early doctor and was really struggling with my confidence and with all this stuff going on. Mm-hmm. And she came in on a cane, hobbled into my office and said, "Dr. Youn, I've been turned down by 15 other plastic surgeons. You're my last hope. Will you please help me?"
Wow.
So I said, "Well, what happened? What's going on?" And she said, "I had a tummy tuck done by a different surgeon about a year ago or so, and everything fell apart. I developed some type of flesh-eating bacteria.
Oh.
My stomach, the skin turned black, and I developed these horrible infections. And I was in the hospital for months as they were skin grafting, doing all these operations. And what I'm left with now is this horribly scarred tummy, and I'm in so much pain that my husband won't even look at me. I feel deformed." And she said, "The worst part of it? Worst part is I can't play with my granddaughter." And she said, the one thing I ask you is please help me to be able to play with my granddaughter again." Mm-hmm. So I ended up, looking at her, and I looked at her medical history. And Glenn, I tell you, it was a nightmare. She had multiple heart attacks. She had a stent placed. She was on blood thinners. She was significantly overweight. She had diabetes. She was on like 20 different medications. So it's just a complete, medical mess, really. Mm-hmm. And anybody would look at this and say, "You know what? This is not the person you should operate on. She is just a setup for a major complication, including death." And yet, when I looked at her and she said, she's pleading with me, I felt this sense of calm where I felt that I was basically being told in one way or another that it was okay and that she was going to be fine and that I was meant to help her. So I bring her to surgery and I tell her, look, before surgery, I say, "Look, there's no guarantees here." I said, "There's so many things that can go wrong. Are you sure you want me to do this?" And she said, "Yes, my life is over if you don't do this. I can't do anything that I want to do." So Glenn, I brought her to surgery and performed a 3 to 4 hour operation, and during this operation, everything is going so smoothly that I almost feel like my hands are moving on their own. Like it's
oh wow,
not
you're
even
in the zone
doing this. I'm in the zone, and everything goes absolutely perfectly. And she came back to see me 6 weeks later, no cane, huge smile on her face with a carrot cake that she's baked for me. And she said, Dr. Youn, I know that my insurance rejected the claim and they're not paying you for the surgery. She said, I don't have any money to pay you, so I made you this carrot cake. And I hope that you'll accept this as payment in full. So I said, well, of course I will. And she said, I need to tell you something. And I said, well, what is that? And she said, yesterday was the first day I was able to play with my granddaughter in over a year. And she said, I want to thank you for that. And she said, I need to ask you something. I said, well, what? And she said, why did you do it? And I said, well, do what? She said, why did you take a chance on me when nobody else would? 15 other surgeons turned me down.
And didn't get paid.
I said, you know what? And I said, you know what? And I said, I felt that this was the right thing to do. And I felt that somebody was watching out for us and that you were going to do just fine. And she said, and that was when she said to me, she said, you know what? Some doctors, they think they're God, not you. You know, they say that they're playing God, but it's not you. And that was where the title of my book came from, Playing God. And I said, no, like I'm not God, far from it. I'm just a doctor.
Right.
You know, I need God to help me, to help you, and to help my patients. So that's where it all came from. It's this idea of the evolution of a modern surgeon. And like we've talked about, through this interview, a modern surgeon is different than the surgeons of yesterday. And what I really wanted to do with the book is write a book showing that this is a journey that today's modern surgeon, holistic surgeons go through. And a lot of it really comes down to the patients and relying on a higher power to get us through the day sometimes.
What's your audience for this book? Is the book full of stories like you just told, or is it technical, or give me a better idea?
Yeah, this is a memoir about my journey from becoming a new doctor through all the different training, from being a general surgery training and plastic surgery training, with all the stories of what it's like to go through all of that. So it really is a book about becoming a surgeon that has the stories of all these patients whose lives that have profoundly affected me. And a lot of these, the interesting thing is that these are stories of patients that are very common from other doctors. If you talk to other doctors, there's always these handful of patients, of the thousands that we see, that always stick in our mind because they have affected us so profoundly. And so it's their stories along with mine. And it really is for anybody who's interested in learning what it's like to become a doctor and how you get to that point of becoming a successful modern surgeon.
Fantastic.
So it's a memoir. It's a fun, quick read where hopefully I'll make you laugh. There are some parts of it that are quite sad and affecting, but in the end, it comes down to, getting to that point where how are we helping people in the right way?
That's terrific. Well, Dr. Youn, I really appreciate the insight on kind of an alternate plastic surgery world that I had no idea existed, holistic plastic surgery. So I really thank you for sharing that with me and my audience. How can people get a hold of you?
Well, I'm very active on Instagram and social media. My website is dryoun.com, and we do have a free gift for anybody who's interested. It's a free ebook, What to Eat to Look Younger. So if you're looking for some of those holistic options, then you go to the website, dryoun.com, and we'll send you that free gift online. And then the book is called Playing God, The Evolution of a Modern Surgeon. That's available on Amazon, on Barnes & Noble, wherever you can find books.
Fantastic.
And we have free gifts, too. If you buy the book, we have a couple of free gifts that we send you as well. You'll find all that information on my website.
Wow. Fantastic. dryoun.com. Thank you very much, Dr. Youn. I hope you have a wonderful day.
Thank you so much for having me on.
Thank you for listening to this episode of the Live Fit Podcast. Please subscribe and share with someone you care about. Read show notes, articles, resources, and learn more about our weight management programs at livefitpodcast.com. Once again, thanks for listening, and always remember to live fit.